A family wants everything to run smoothly during a pregnancy and afterwards. Dr. Stephanie Cropper, who specializes in obstetrics and gynecology, tells us about the many services available at the Women's Center at Pomona Valley Hospital Medical Center.
Our hospital offers a lot of really wonderful childbirth classes. They have ones for breastfeeding. They have classes for patients who know they're having a cesarean section. They have birthing classes as far as talking about ways to labor and ways to deal with the pain other than an epidural. They have a wonderful Baby Express class, which kind of is an overview of all of those things, the whole labor process, a little breastfeeding, and it also goes over what you need to do when you take the baby home as far as how to swaddle the baby, shush the baby, SIDS prevention techniques, and a lot of things. It can be overwhelming, especially with your first child, when they hand you that baby to send you home, and it helps relieve a lot of the anxiety. And they also have childbirth class for dads, and then they also have the instructor to help dads help the woman along through labor and even during the pregnancy, and then what to expect when they go home as well.
Dr. Cropper tells us about the active labor management classes.
We're trying to reduce the cesarean section rate, and patients who are active throughout their pregnancy do really well. And then we have classes on using the birthing ball and things like that during labor. We try to have women walking during labor, bouncing on their ball, and even after an epidural we have something called a peanut ball now, so we can do a lot of different position maneuvers during labor for women who decide to get an epidural and aren't mobile or can't stand. For women who don't get an epidural, we have lots of different birthing positions. People will labor on their hands and knees. We have women who use a squatting bar to labor in the squatting position. So our nurses are really good at coaching the patients and helping them to stay active during labor to help the labor progress.
Support groups are available to help women and men through the pregnancy, birth, and after.
And we have a postpartum support group as well, and women can actually attend that during pregnancy. Some women have a pregnancy that's not planned, or they something happens to their partner and they feel alone during the pregnancy, or they're just having problems along the way with the pregnancy, or when they go home. And that support group meets every other week. I've had several patients really get a lot of help from that group. And they actually have a class for dads so that they can help to be more supportive, because a lot of men don't understand what women are going through when they're experiencing postpartum depression. And it can be frustrating for them because they don't know what to do or how they can be helpful or the right thing to say. So the hospital offers a lot of wonderful classes like that. And a lot of women they think that breastfeeding will just come naturally, and for a majority of women it does. But our nurses are excellent at helping women while they're in the hospital with the breastfeeding, and we have special certifications as being a breastfeeding friendly hospital. And when women leave the hospital, if they experience problems, they can reach a lactation consultant even when they go home. And that has been really helpful to ease the frustrations that they might experience.